everyone, welcome back to my channel. So today I wanted to talk about what are neurological symptoms. And there's a reason I wanted to address this topic. If you have not seen my exosomes playlist, I talk about my exosomes treatment, which I'm still, I guess, in the process of. And I talk about how it has really flared up my neurological symptoms. Now, I've spoken to other people with Lyme disease. I've seen, I've communicated with other people with stiff person syndrome. We have an awareness of, conditions like multiple sclerosis. Selma Blair has multiple sclerosis. And those are neurological. There's a lot of neurological involvement there. But I've seen a lot of times people claiming, that they have like neurological Lyme, and their symptoms are like fatigue, muscle aches, things like that. I feel like there are a lot of people that are quick to claim that their symptoms are neurological when they are not neurological. Now, I'm not a doctor. I imagine that, a symptom like brain fog could be neurological, but it could also be infectious. It could be a lot of different things. But during this journey of doing the exosomes, it has flared up my neurological symptoms. And I have felt many different varieties of neurological pain that I have never felt before. I probably felt every type of neurological pain and sensation that I didn't even know existed. And so I do think there is a difference between neurological symptoms and other symptoms. And I think it's important to make that distinction, or at least I'm going to tell you the distinctions that I have made, because if you do choose to do some type of treatment, for example, stem cells or exosomes, things like that, my guess is, especially from my experience, my guess is that if you have a lot of neurological involvement, it is going to be a lot harder for you to recover if you do. And you're going to be in a lot more pain and a lot more discomfort. Even if the treatment works or if the treatment doesn't work, in my case where I'm not seeing any improvement so far, it can exacerbate neurological symptoms. But like I said, I have a feeling that for people that do have a lot of neurological involvement, any type of treatment is going to go differently. I don't know what it is about the nervous system that makes it very, very difficult to treat. It could be the brain. I think, one of my doctors mentioned that the blood-brain barrier makes it very, very difficult for any medications, any drugs, even stem cells to get into the brain. And when you have central nervous system involvement, you need to get to that brain, which is why she recommended exosomes. And again, which is probably why exosomes can be very aggressive on neurological symptoms, because they do get to your brain. So we know a lot of common neurological conditions, multiple sclerosis being one, but multiple sclerosis is visible on an MRI. You see that the sheath around the nerves is being worn down or being attacked, and it's being damaged. And then once that's gone, that protective layer is gone, it directly damages the nerves. And you can kind of see that on like imaging studies and things like that. Neuropathy, that burning feeling. Burning is, another common neurological symptom. Muscle stiffness, muscle twitching, fasciculations, that, kind of like twitching. And even sometimes after I would go for a walk, I would feel like a lot of that, like ants running under my skin. So a lot of that would be neurological. Headaches can be neurological, right? Head pain, headaches. I'm talking, when I say muscle stiffness though, I'm not talking about like you need to stretch, because sometimes your muscles are out of shape. I'm talking muscle stiffness. Stretching is not going to help. Exercise is not going to help. Your muscles are stiff. And that, for me, that's a neurological issue because the messaging from the nerves to the muscle is being affected. So that kind of stuff, that's what I consider neurological symptoms. And I'm sure there's a lot more. Spasms, very severe, intense spasms, like you see in stiff person syndrome, that is neurologically mediated. If you have fatigue, I have seen people make claims that fatigue is neurological. Um, Brain fog. I'm not necessarily sure if brain fog is completely neurological. Um, Digestive issues, even intestinal spasms to a certain degree, I don't think are completely neurological. It's difficult. It's difficult. I'm not a doctor, but I want to make that distinction that serious neurological involvement, can result in involuntary movement of your body. For example, very violent spasms, um, severe muscle stiffness. Right. I'm not talking about when you get up in the morning and you just need to warm up. Rheumatoid arthritis has a lot of stiffness, right? But that's not neurological. That's inflammatory. It's not. It's not an issue of the nervous system. So there is a distinction between stuff like that and neuromuscular, neurological stuff. And so I wanted to kind of point that out and talk about that because I have been having that issue since I did the exosomes. So I did exosomes at the end of January. This is probably, repetitive if you've seen my exosomes playlist. And I did immediately, I think after the first 3 weeks, I started having all sorts of crazy things: neck pain, headaches, head pain, pressure in my head. My muscle stiffness was just going crazy. So I was experiencing a loosening of the muscles. So the muscles were open, a lot of twitching, a lot of that. Like I said, I was experiencing the muscles loosening, but then they went the other way and they really tightened up. And that has been, very, very scary, particularly in the thoracic area. This treatment has really highlighted my neurological, my neuromuscular issues, and it feels like almost every single nerve coming out of my spine is affected by whatever illness I have, whether it's SPS or Lyme disease. Because I swear, from my head all the way down to my tailbone, I have had some type of nerve symptom or neuromuscular issue since I did exosomes. Whether it's increased muscle stiffness and pain, I have felt burning sensations. I have felt, there's this other sensation, almost like when you get like embarrassed. I can't even explain it. Like sometimes when you get embarrassed or flushed, where you feel like this prickly sensation up your back. And I was getting that quite a bit in the beginning. And I never thought that was a neurological symptom until this treatment. So it's sort of like a prickling sensation. But again, prickling has been associated with neurological issues. I've gotten shooting pain in my feet. Yesterday, I had an issue with my left ankle. It was like a little bit above my left ankle. And it was just like this pain, almost like the muscle was spasming. I couldn't see it. I couldn't see anything with my eyes in that ankle. But I would feel the pain, almost like an ache, and then it would go away. And then it would ache, and then it would go away. And this went on the whole entire day. And so right away, I was like, you know what? The muscle is spasming out. The nerve is having some kind of an issue there in that left foot. I'm also prone to cramps in the toes in that foot, and I have a feeling that may be neurologically mediated. We do know that cramping can also happen if you're dehydrated or like you're low in potassium or something. But for me, I do think that there was something neurological or neuromuscular going on there because it was all day. It would hurt and then it would just like relax, and then it would hurt and then it would relax. So that would probably be consistent with like a muscle spasm. I have felt, like soreness, but that's a muscle sensation. But the neurological stuff is like more burning, kind of like a tearing type of pain. I've had a lot of that. I am sensitive to light, so I will feel pressure in my head or pain, and that will linger for a long time after I've been exposed to light that doesn't agree with me, for example, fluorescent light. And I think a lot of the reason why I've been struggling through this treatment, because my other symptoms, I want to say my stomach issues have stayed more or less the same. I do have some better stomach days. I have been feeling a little bit more of an appetite sometimes. I have been feeling a little bit better energy off of my oxygen sometimes. It's every now and then, but I haven't been feeling substantial improvement to say that that symptom has improved. But those symptoms don't really seem to be in alignment with my my neurological stuff. My neurological stuff is what's really, really been suffering. And that's why I wanted to make this video, to let you know that if you do have neurological symptoms, true neurological symptoms, you may think that you have neurological symptoms because you suffer from a lot of headaches or fatigue or whatever. But I get the feeling, and from what I've seen from other patients, from what I've read, there's a blog that I read of someone that did exosomes. I've talked about it before. It's called February Stars. And she talked a lot about neurological symptoms, but she had a pretty good recovery, and pretty, I think within 6 months she was doing very, very well. I'm talking about serious neurological involvement. I did have a consult with the only Lyme doctor in Mexico. I had this consult back in, I think at the end of last year. And he suspected that I had something, I forgot what it was called, but he said it was some kind of condition where there's inflammation, I guess, in your spinal cord. And that causes muscles, it irritates the nerves, and it causes muscles to sort of like atrophy or to kind of stop functioning. I forgot what it was called. I did write it down with that consult. And so he recommended that I get a spinal tap. I mean, he was recommending a lot of really, serious things. But he recommended that I get a spinal tap to really see, I don't know what, if it's an inflammatory thing, then it's an inflammatory, right? But what I took away from that consult was that he agreed, that I was having a lot of neurological symptoms, that there was something going on with the spinal cord or with the nerves, in the spinal cord and the brain. And so, he kind of didn't address, because I was looking into stem cells and exosomes at the time, and he didn't really address that. He was like, you need to do all these tests first. But what I did take away from that appointment was I have some serious neurological stuff going on. And I think it's tough to treat. I think it's difficult. I think, even if stem cells or exosomes does work for you, it's going to make those issues flare up, and they can be quite painful. I just have had a hell of a time, to be quite honest. And I do think it's because of the neurological symptoms, because I have extensive neurological involvement, and I want to say severe, but I have seen other people with SPS that have very severe spasms, to the point where they can't walk, to the point where they have difficulty eating. I am not completely incapacitated by it. I do consider this, if we're talking about Lyme disease, I do consider this pretty serious compared to what I have seen in other people. If we're talking about SPS, then I might be on the milder end of that. And I did have my SPS doctor tell me that I probably had mild SPS. But when it comes to Lyme disease, I really think that we have to be honest with ourselves, especially with neurological symptoms, because, neurological symptoms can be very, very debilitating, very incapacitating. I know that there are people that have become paralyzed. They have lost function of their legs before they did their antibiotic treatment. And a lot of that's because it's attacking the nerves, So really think long and hard about whether your symptoms are neurological, or if they could be, metabolic symptoms, if it could be, something that is attacking your energy reserves. What is that called? I forget. But something that is attacking your ability to things that cause fatigue are attacking your energy reserves and things like that. And sometimes you need to supplement with B12, or you need to take a different course of treatment. But in my case, I do think there's a lot of neurological stuff going on. And again, the brain is a difficult thing to reach. And I don't think these treatments are foolproof. I don't have any damage as far as, if I have an MRI done, there's nothing that you can see there. So it makes it even harder to really figure that one out. But yeah, I just wanted to kind of give you guys a heads up. I may add this to my exosomes playlist for those of you that are considering doing exosomes or stem cells, because if you do have extensive neurological involvement, I don't know how this is going to go for you. I still haven't, I still can't give a concrete recommendation. I think for people that are suffering maybe from long COVID and you don't have a lot of, and they do say that you can have neurological issues after long COVID, but long COVID hasn't been around that long. It's been around for 2 years or so. And so that may respond better to exosomes and stem cells because you're getting it done pretty quickly. I mean, relatively quickly in comparison to something like Lyme disease, where people are suffering from 6, 10, 15 years before they are doing stem cells or anything like that. So yeah, just know going into these treatments, it's really iffy. I do know that there are studies in like mice that have had neurological damage. They've given them exosomes or stem cells or something, and they recover quite well. I think like stroke or something. Stroke patients seem to respond well, but again, that's acute injury as opposed to chronic inflammatory stuff, I guess. But that's my take. And I just wanted to give my opinion on it. I'm the one living inside my body, and this is kind of how I feel after, I'm going on 6 months post exosomes. And this is sort of like my educated guess as far as who's going to respond well to this treatment or who's going to respond quickly to this treatment and who is not. So I do think that neurological stuff, neurological issues and also actual damage, if you do have actual damage to your nerves and things like that, I think that may make things more difficult. You may feel better for a little bit and then kind of go back to how you were, because I don't see how exosomes or stem cells actually repair damage. They may be able to reduce the inflammation related to it, but the damage is still there. And we do see that with Selma Blair. She is doing better and her MS is in remission, but unfortunately the damage that was done, and she's still having some like speaking, difficulties, walking difficulties. She does have some motor issues. And again, that's due to brain and nerve damage. And the stem cells may have put her into remission, but I don't know if there's a way to repair actual damage. I don't know if I have damage on a sort of like microscopic level. It's possible. But again, I don't know. So that's what I have for you guys today. Thank you for joining me. If you have any questions, please leave them down in the comments. I will do my best to answer questions related to this treatment. But again, I'm giving my opinion, and all I can do, I'm not a doctor, I'm just a patient. But I do believe that a patient's opinion and a patient's observations, especially patients, there are some patients, like I said, there are people that believe that everything that they have is neurological. It's all neurological. But I do think that there are some patients that are very attuned to their bodies, and they sort of can read their symptoms really well. And any little thing that I do, when I did IVIG, when I take any kind of medication, I'm always observant of what effect that has on me. And I don't know, I just feel like this could help somebody, because some people aren't as observant. Some people get very overwhelmed by their symptoms, and that makes it very hard to make an informed decision, which is why I've been making the videos about exosomes and other types of things, because I want you guys to make the best possible decision. We're not all the same. I understand that some people may respond better to that treatment. I may not respond well to something that you've done well on, but this is just my take. And I want to be clear that this is my take, my opinion, my educated guess as to why I'm struggling with this treatment. And that's, that could be helpful for someone. There might be someone out there that is a lot like me and struggles through everything. So yeah, that's what I've got for you guys. This video has gone on long enough. Please like and subscribe, and I will see you in the next one. Take care.